Hello everyone, my name is Anna Dominic Gison and I will be performing insulin administration. First and foremost, what is insulin administration? Insulin administration is the injection of prescribed dose of insulin through the subcutaneous route. Insulin is injected subcutaneously, which means into the fat layer under the skin. In this type of injection, a short needle is used to inject insulin into the fatty layer between the skin and the muscle. What is its purpose? Insulin is used to control blood sugar in people who have type 1 diabetes or in people who have type 2 diabetes that cannot be controlled with oral medications alone. Usually, the prescribed ones are the human insulin. It is in a class of medications called hormones. Human insulin is used to take place of insulin that is normally produced by the body. It works by helping move sugar from the blood into other body tissues where it is used for energy. It also stops the liver from producing more sugar. All types of insulin that are available work in this way. The types of insulin differ only on how quickly they begin to work and how long they continue to control blood sugar. And now, let us enumerate the materials needed. These are the dry and wet cotton balls. The wet cotton balls should be soaked in alcohol. Then, insulin vial, insulin syringe, medication tickets, insulin injection log, waste receptacle, and lastly, the injection towel. Once you've gathered all the materials, let us now proceed to the insulin administration. First and foremost, we need to check the patient's chart for the doctor's order for insulin administration. This ensures that the procedure is indicated by the doctor for the patient. Next, we need to transcribe the doctor's order into the medicine ticket. This serves as a reminder that the insulin is ordered by the doctor to administer during the time specified. Next, we need to explain the procedure to the patient. This relieves the patient's anxiety and promotes for cooperation. The next step is to bring the hypo-tray with the materials to the patient's room. Place it on the bedside table. Next is to ask the patient to state his or her full name. Compare it to the medicine ticket. Next is to select and expose appropriate injection site. This is to prepare the site for administration of insulin. Next is to get a wet cotton ball and disinfect the site of injection, then discard. This is to disinfect the site of injection and to prevent contamination. With another wet cotton ball from the tray, disinfect hands, then discard. This is to prevent cross-contamination and adhere to the principle of microbiology. Next is to get a sterile dry cotton ball and place it between your small finger and ring finger of the non-dominant hand. This will be used in applying pressure after the administration. Next is to get the insulin syringe from the injection towel using your dominant hand. Remove the syringe cap. Dominant hand is used to have a good grasp and control over the syringe. Next is to grab a substantial portion of the skin and subcutaneous tissue between the thumb and the other fingers of the non-dominant hand. This is to ensure that the insulin will be administered in the subcutaneous tissue. With the dominant hand, inject the needle into the site using a 90-degree angle, since the needle of the insulin syringe is very short. Then, support the hub with the thumb and index finger of the non-dominant hand. This prevents the hub from being pulled out of the skin. With your dominant hand, slowly push the plunger down to deliver the medication, using the cigarette position. Next is to place the dry cotton ball over the injection site, apply very light pressure, then withdraw the needle quickly. Then, you need to check for bleeding and possible reactions or complications. Do not massage the injection site. After which, you can do aftercare by disposing the syringe on its respective receptacle, putting back the vial in the refrigerator at a temperature depending on its package instructions, and disposing materials that are needed to be disposed. Then, document the following on the insulin injection log: the type and amount of insulin used, site of injection, date and time of administration, route of administration, and the reactions of the patients if there are any. This is to have a proper documentation of the procedure done and to serve as a reference to other healthcare team. And that's it for insulin administration. I am Anna Dominic D. Gison from DSN 3C.